Hello there, Dr. Jed. Looks like I'm here to learn something new again. Hey there, nice to see you. How are you doing? I'm fine. You? Oh, I'm great. Better than ever. Alright, how about now we learn about NSAIDs, corticosteroids, and antipyretics. Woohoo! Just to let you know, NSAIDs stand for non-steroidal anti-inflammatory drugs. I'll talk more about them later. By the way, can you tell me any NSAIDs you have heard of? Ibuprofen. I've taken those before. Nice. Now, how about if we dive deeper than just mentioning ibuprofen, shall we? Sure. Let's define or generalize NSAIDs. NSAIDs are basically drugs that can reduce inflammation and often carry pain-killing and fever-reducing effects. Analgesics is a term given to define drugs that reduce pain or kill pain. Antipyretics is a term to define drugs that reduce fever temperatures. Now, NSAIDs do have pain-killing properties, but they are only effective in reducing mild to slightly moderate pain. Severe pain, by the way, should be handled with opioid-based analgesics, which are very strictly controlled. When NSAIDs are generally abused over a long and sustained time, this may lead to the deterioration of kidney function. Okay, now, what are the examples of NSAIDs other than ibuprofen? Aspirin and paracetamol are some very common NSAIDs you can find. Now I'll discuss them one by one in greater detail. Alright, say we start with aspirin. Sure, no problem. Aspirin is a salicylate NSAID, which means it uses salicylic acid in its production. It has pain-killing, anti-inflammatory, and fever-reducing properties. It reduces inflammation by inhibiting the enzyme cyclooxygenase, which can be abbreviated to COX. This inhibits the biosynthesis of thromboxanes and prostaglandins from arachidonic acid. Aspirin is used to relieve symptoms for headaches, joint inflammation or what we call arthritis, and other mild to moderate pain. Those with influenza or other diseases that cause fever can take aspirin to reduce their fevers. However, children should not take aspirin because of its connection to Raynaud's syndrome, a syndrome characterized by liver degeneration. Because of that, lactating women or women who are breastfeeding should also not take aspirin, as aspirin can enter the breast milk and the infant that is currently being breastfed can ingest traces of aspirin. Aspirin can be taken orally with or without meals, but eating it with meals may reduce stomach or intestinal discomfort caused by its side effects. So the most common general side effect of aspirin is gastrointestinal disturbances. Talking about who should not take it, are there any other criteria for who should not take aspirin? Other than children below 12 and breastfeeding women, those with severe kidney or liver impairment, those with indigestion, and other gastrointestinal conditions or issues should not take aspirin. Now, I've heard of the possibility of an aspirin overdose. So what are the symptoms that are associated with an aspirin overdose? Vomiting, dehydration, vertigo, sweating, and a warm skin is a list of a few symptoms experienced in the case of aspirin overdose. Nice. Now, how about we talk about ibuprofen? I've heard about it, just a bit about it, but I want to know more about it. No problem. Let me talk you through it. When you take ibuprofen by mouth, it can manage fever, migraines, and manage mild to moderate pain. It can also help manage inflammatory diseases like osteoarthritis, or joint inflammation, or bone inflammation. It can also be used topically through the skin to relieve joint pain. Some people may feel gastrointestinal discomfort, headaches, dizziness, and after taking ibuprofen as its side effects. Those with asthma, bleeding disorders, cardiovascular diseases, peptic ulcers, kidney failure, and those hypersensitive or what we call allergic to aspirin, and those receiving Corticosteroid anticoagulant should not take ibuprofen. Of course, those hypersensitive to ibuprofen should also not take ibuprofen. Now, what are common signs of ibuprofen overdose? Headaches and drowsiness are common signs of overdosing on ibuprofen. If you are taking ibuprofen to manage your fever and you feel a headache, it may not necessarily be an ibuprofen overdose, considering that some diseases can cause headaches, such as sinusitis. The inflammation of the sinuses caused by a reaction of your immune system against pathogens like bacteria and viruses. Ibuprofen, when taken orally, should be taken with food to avoid gastrointestinal discomfort. So, how does ibuprofen work? Well, firstly, I would like to state the properties of ibuprofen. It has pain-killing, fever-reducing, and anti-inflammatory properties. Its anti-inflammatory properties are mostly derived by inhibiting the synthesis of prostaglandins by inhibiting the enzyme cyclooxygenase 1 and 2, or what we call COX-1 and COX-2 enzymes. Wow, thanks a lot for that brilliant explanation. Sure, no problem. At this rate, I think we'll breeze through this. Let's quickly move on to paracetamol and get done with NSAIDs so I can talk about corticosteroids too within our limited meeting time. Yes, go ahead. The stage is yours. Very well. Paracetamol is not an NSAID because it actually has very little or even no functional anti-inflammatory properties. However, paracetamol is an antipyretic and an analgesic, which means that it can reduce fevers and it also has pain-killing properties. Some may also feel headaches, vomiting, nausea, and constipation after taking paracetamol. Overdose symptoms include nausea, vomiting, and abdominal discomfort, and a more severe overdose can cause liver damage. Paracetamol can be taken orally or by mouth, with or without food. We should not take paracetamol. Those who are hypersensitive or show allergic reactions to paracetamol and those with impaired kidney or liver function should not take paracetamol. So how does paracetamol work? Paracetamol's pain-killing properties are derived from how it blocks the peripheral nerves from pain impulse mechanisms. Paracetamol's fever-reducing properties come from how it inhibits certain thermal regulation, which is the control of body temperature, and is part of homeostasis, which is the balance of things in the body, which is processed in the brain's hypothalamus. Now, I guess let's talk about hydrocortisone. And I'm guessing by how it's named with the suffix "-sone", it sounds like another corticosteroid. You're absolutely correct. Hydrocortisone is another corticosteroid. But you know what it's for? No. I'm not exactly sure about what hydrocortisone is for, but because you said it's a corticosteroid, I'm guessing that it is used to treat inflammation. Sorry if I'm not very specific about it. Well, you're right in saying that hydrocortisone does treat inflammation, though you did not go into much detail about it. To add on to what you said, there are different purposes of hydrocortisone depending on how it is administered. When you apply hydrocortisone acetate in the form of a lotion, cream, or ointment on the skin, hydrocortisone acetate can be used to treat inflammatory skin disorders like pruritus, intense itchiness on the skin. When hydrocortisone is taken through the mouth as a capsule or tablet, it can treat inflammation diseases, but can also act as an immunosuppressive medication. So it's important that those with ongoing or an untreated infections, so like cerebral malaria, and those taking live inactivated live viruses vaccines should not or avoid or carefully take hydrocortisone depending on what your doctor says. Hydrocortisone should be taken with food when taken orally. Hydrocortisone when taken orally could be used to treat deficiencies in adrenal corticoids, a hormone produced in the adrenal cortex of the brain. Hydrocortisone in the form of eye drops can treat eye inflammation, and when administered through the rectum or anus, it could be used to treat hemorrhoids. Wow, hydrocortisone has such an extensive list of uses. Cool, but how does it work though? Hydrocortisone is a drug version of cortisol, a glucocorticoid hormone secreted by the adrenal cortex. It reduces inflammation by suppressing polymorphonuclear leukocyte migrations and by decreasing the permeability of capillaries. When applied onto the skin, it has anti-itchiness, anti-inflammatory, and vasoconstrictive properties. What are the most significant adverse effects of hydrocortisone? Adrenal suppression and immunosuppression are some of the significant consequences of taking hydrocortisone continuously for a long period of time. Overdose symptoms include nausea, vomiting, and high blood glucose or blood sugar levels. And well, that's all for today's meetup, and I'm done talking about this topic. Take care and bye-bye. Thank you so much for teaching about medications for the past few weekends. I really appreciate your efforts. Again, thank you. Take care, stay safe, and bye-bye, Dr. Jed.